Hello, welcome back to PCM, Crisis Management Training, Section 3, where we're going to talk about the crisis continuum. In order to do this, I will ask you to open up your training manual to the appendices in the back and go to Appendix G. It looks just like this. I'll give you a second to get there. All right. One of the most effective ways to deal with any crisis situation is first to identify the cycle of crisis. That starts with a predictable pattern. That starts with a precursor behavior or behaviors. This is when the person starts to show small signs that they may be agitated or that a problem may be happening. It then moves to more obvious signs before finally turning into a more significant crisis behavior. And then at some point that behavior stops and the person calms down. PCM conceptualizes crisis in this same way, with 4 levels that you should see in front of you, listed as stable functioning, pre-crisis, crisis, and post-crisis. We'll talk a little bit more about those in a minute. Now you'll notice that each level is categorized by 4 components. The first one is behavior. This is the observable or measurable behaviors that the person is exhibiting. Next is thinking. This has to do with whatever may be going on in the person's head, or what they may be saying to themselves. Next is feelings. This can be any types of emotions that they're having: happy, sad, frustrated. And last but not least, physiology. This can be heart rate, blood pressure, muscle tension. If you're watching the person, you may see this if they get like a scowl on their face, or clench their fists, or start to move back and forth. Those can all be telltale signs that the person's physiology is heightened. So let's go ahead and explore these levels in more detail. Along this crisis continuum, you will see what looks like a bell-shaped curve. And you'll see along the bottom the progression of time, moving from left to right. And then the progression on the left from adaptive at the bottom to maladaptive at the top, such that the tip of that bell curve indicates the highest and most dangerous point of crisis. So let's start with level 1. Level 1 is stable functioning. Now what does that mean? Well, if you look at the 4 categories underneath, you can get a better idea of what that would look like. Also, don't forget, these levels are your study guide questions, so please be filling these in as we review them. So, level 1, stable functioning. This is when the person is on task, meaning they're engaged in whatever therapeutic or leisure activities are appropriate for the setting. This may be engaged in a social conversation, personal hygiene tasks, or a game. Thinking is reasonable. Now, if this is going on inside their head, you may not know this is happening. But for somebody who can tell you, this may be, well, I'm not sure about that, or, oh, this is going to be fun, or, oh, that was harder last time. The thoughts match the reality of the situation. Next is feelings. This is appropriate. If they're doing something fun, the feelings should match. They should be smiling. They may even be able to tell you that they feel happy. And last, physiology. this should be relaxed. Or, I guess if you're doing something fun, it could be excited. But this would be the preferred physical state. Now, as many of the individuals that we may work with may not be able to talk or tell us what they're thinking or feeling, you'll likely be basing most of your assumptions on the behavior and the physiology, as those tend to be most observable and measurable. So, what happens when the person transitions from level 1 to level 2, pre-crisis? Well, you'll notice that the behavior changes from on-task to off-task. Now, what might this look like? Let's say you're playing a game with your student, and then they start looking away, focused on what somebody else is doing. This is an example of getting off task. Thinking unreasonable. This may be if they're telling themselves that they're no good, or this is too hard for them. Next, feelings inappropriate. So they may be upset about a situation that is commonplace. This may lead you to think that something else is going on other than the current. Last but not least, physiology is heightened. This is where we start to see agitation and agitation-type behaviors. For individuals with autism, this is where you may see self-stimulating behaviors designed to calm themselves down, such as rocking or hand flapping or other related behaviors. Now, if this behavior isn't appropriately dealt with, they're likely to transition into level 3, which is what? Crisis. And if you remember from chapter 1, PCM defines a crisis as what? Continuous aggression, continuous self-injury, continuous high magnitude disruption. In this case, the person is engaging in continuous serious behavior that is likely to cause injury to themselves or others, putting you in a position to have to physically manage the behavior. Or in some cases, be able to successfully manage it in another way. Their thinking is irrational. They may think that you're out to get them, or that they're no good, or something of that sort. Their feelings are inappropriate. They may be screaming and crying on the floor, trying to hit their head because they lost a game. It's just a game. But they may not understand that. It may be more difficult for them than you realize. And last but not least, physical arousal is at maximum. This is what we would call a fight or flight response. The person is using all of their physical energy or stamina to engage in dangerous behavior. This is when we use our PCM, crisis management procedures, to help de-escalate and keep the person safe until they transition to level 4, which is post-crisis. Now, how do we determine whether someone has actively transitioned to level 4? Well, the most clearly observable way is their behavior. At the point that they achieve post-crisis, they should be able to be back on task. Now, this doesn't mean sitting quietly in a chair calming down. This means when they're able to follow simple instructions like perhaps stand up, come over here, help me put this away. Once the person is able to follow instructions and get back onto programmed activities, social interaction, or other treatment-relevant activities, then the person is considered to have moved to post-crisis. However, if you look on your diagram here, you may notice that level 4 is higher than level 1, even though the person's on task. Let's take a look at the other categories to figure out why that is. Thinking is reasonable. That's the same as level 1. Feelings, however, and physiology are different. The feelings may be neutral or negative. The person may have some negative feelings about the incident that just occurred. Or they may be ambivalent. However, their physiology is still heightened or subdued. After any kind of serious physical exertion, we may still be experiencing some effects from the adrenaline, or we might be exhausted from tiring ourselves out. This tends to leave people in a somewhat irritable state. And so, we need to be careful. And this is why we use post-crisis strategies, because we need to make sure that we slowly and subtly transition our learners back into the programmed activities that we have to avoid digressing back into level 3 or crisis behavior. Now take a look at the bottom of your page. You should see some writing right below where it says time. This should have the 4 levels of client behavior and the 4 primary strategies that you learned in section 1. This is given to you as a decision tree of sorts to help you decide what PCM strategy is most appropriate for you to use at that time. Let me give you an example. Let's say your learner is in level 2, pre-crisis. Look down at the bottom, cross the hyphen over onto the right-hand side. Which PCM strategy corresponds to pre-crisis? If you said crisis de-escalation strategies, you're correct. What about post-crisis? Corresponding strategy is post-crisis strategies. And for stable functioning, it's crisis prevention strategies. These are things that you're going to need to know for your test, as well as in your work. Because much of what we do corresponds to the behaviors of our learner. So it's important that you use the appropriate level and appropriate strategies for each situation. Now let's talk about when our crisis strategies don't work. We get what's called breakdown of crisis intervention, or partial failure. Now, you should keep in mind that if crisis procedures are done effectively, appropriately, then it's often uncommon for individuals to return to crisis shortly after de-escalating. This provides you with an excellent opportunity for problem solving. Let me give you some ideas how that may go. If crisis procedures are implemented correctly, you should see a smooth and stable transition into post-crisis. When I've worked with clients in the past, this may look like the person crying, apologizing, and potentially making restitution, cleaning up or trying to fix anything that was thrown or broken, or helping if somebody was hurt. However, if techniques are not used appropriately, this is when you may see digression back into crisis, or if the individual is somehow reinforced by the crisis management procedures, which can happen. And this is an area for a BCBA to help intervene, to find out what's really going on. So if you see any of these things happen, or you're not sure, please check with your supervisor. Thank you. This ends section 3.